The broadcast is now starting. All attendees are in listen-only mode.
Hi everyone, my name is Susie Caldero. I'm one of the NCLEX instructors, and today I'm going to be facilitating the webinar on the 6 Steps Question Success. This is an essential tool for you to have and understand how to answer questions on the exam. You probably have heard us say many times that the NCLEX is not like any other exam you've ever taken. NCLEX is not about measuring your knowledge. It's about how do you apply your knowledge? How do you apply what you know to a scenario and provide the best outcome for that client based on that scenario? These are some of the things that you're going to be faced with. And in addition to building your knowledge on all kinds of topics from A to Z is also very important. How do you apply that knowledge using strategies, understanding what the question is asking, looking for those keywords and being able to look at for the answer that's going to fit the question the best. And that's what we're going to be covered on this webinar. But before I get started, there's another area that I wanted to just kind of talk to you a little bit about, and that is about what constitutes the right answer on the NCLEX exam. You ever thought about who comes up with the right answer? What makes it correct? Well, there's 4 truths that we follow, that NCLEX follows, that would make a question or answer correctly. Correct. And truth number 1. The first one is it scientifically proven? We know scientifically that an answer is correct because science has proven that. For example, I think about ACLS. You think about a patient who's in VFib. According to ACLS, it says defibrillate as soon as possible based on that science that it's going to provide the best outcome for that patient. Truth number 2, is it evidence-based? We've heard of that term, right? Evidence meaning that we know that evidence has proven that if we follow this protocol or this process, it's going to provide the best outcome. Just like a lot of times for heart failure patients, we often give them an ACE inhibitor. That's based on evidence, and that one makes that answer correct. The third one is best practice. Well, we should all be familiar with best practice. Best practice is showing us that if we do this, it's going to give us the best outcome. For example, washing your hands, right? Best practice. Or wearing a mask during COVID. These are things that we do because it's best practice. The fourth one's a little bit more trickier, which is based on theory. Theory that's accepted in the healthcare. Theory that tells us that we know that this works. Like, for example, a theory that comes to mind is Erik Erikson's stages of cognitive development. It's an acceptable theory when it comes to looking at how clients have developed throughout the stages of the different stages of life. And based on those stages and how someone is reacting to something is what's going to help us understand what would be the best answer to that question. For example, an adolescent would be in the stage of identity versus role confusion. So what is going to be an important key characteristic in that stage that's going to help that 14-year-old, 15-year-old go through that stage? Well, one of them could be relationships, could be a key factor, and that could be one of the answers on the question. So understanding the truth of what is the NCLEX answers is also important as you develop your knowledge along the continuum of the program. Now we're going to go into 6 steps question success and how this is going to help you decipher those questions and look for one of those truths. Okay, so I'll take off the camera, but then we'll go ahead and look at this PowerPoint as we go along. All right, so let's get started. So types of questions on the NCLEX. One of the best ways to defeat the NCLEX is to know going into it what type of questions are going to be asked. The NCLEX is based on a set method for writing questions known as Bloom's taxonomy for cognitive domain, one of those theories we talked about. In fact, the NCLEX RN test plan for NCSBN states Bloom's taxonomy is used as a basis for writing and coding items for the exam. And this is kind of what Bloom's taxonomy may look like based on the pyramid. So remembering is at the bottom. This is the first step in learning and understanding, is just remembering things. That's why on knowledge level exams, you might only need to be able to function in this level as remembering and memorizing facts that you could regurgitate on an exam. As you move up this pyramid, the next step is understanding. Understanding is making those sense out of the information. And once you get past this stage, then you get into the applying or application stage. This is also very important. This is where we get into those critical thinking skills. I'm sure you've heard of those terms thrown around a lot. And what is critical thinking? Is really applying, analyzing, evaluating, and creating. It's really just taking all of the information, all the pieces to the puzzle, putting them together and making sense out of it. And here is at the application levels where you want to be. This is where you want to be functioning when you're looking at questions and trying to put them together and trying to understand the question. Since the practice of nursing requires application of knowledge, skills, and abilities, the majority of items on the NCLEX are written at the application or analysis level, or sometimes higher. It is for this reason that nursing educators repeat that catchphrase, as I mentioned, critical thinking over and over and over. Okay. So parts of the NCLEX questions. Well, now that you know what type of questions to expect on the test day, let's move on to the actual questions themselves. The NCLEX is comprised entirely of multiple choice questions. Your ability to work as nurses comes down to a single test with multiple choice answer options. Now I'm going to throw in a little bit of interjection or a little commercial break here. Currently, this is how it is. Future NCLEX exam questions may differ a little bit with case scenarios, and we will be approaching those in a future time. But for right now, for those of you who are testing between now and 2024, you're going to be looking at an exam that is entirely of multiple choice questions. Do you now think it's important to understand a little bit more of these questions? Okay. So basically, you have two options. You can complain about the tests, the questions, and the answers, or learn everything you can about the questions and how to dissect them and demolish them. Since only one of these options is going to get you closer to being an RN in the USA, let's focus on learning how to dissect the question. Do you feel like this sometimes? I could only imagine how overwhelming it is. Some of you are just starting in the program and you're just excited and motivated and you're ready to get started. Some of you have already started and are starting to feel a little bit kind of disappointed in yourself. Some of you are in phase 2 in the middle towards the end and you're kind of getting tired, aren't you? And those of you who are just about ready to take your NCLEX exam are getting excited about it and wondering, have I learned everything I need to know to pass the NCLEX? No matter where you are in this stage and in the program, we're here to help you to be successful. So how to master NCLEX style test questions. The NCLEX RN exam is not a test about recognizing facts. Remember I said earlier, it's not in that remembering stage. You must be able to correctly identify what the question is asking. Now that you know are more knowledge about the components of multiple choice test question, let's talk about specific strategies that you can use to problem solve your way to correct answers on the NCLEX RN exam. And so we're going to go ahead and get started with our 6-step question success. I encourage you, if you haven't already, to grab a paper and pencil because you might want to write some of these things down. Okay, and here we go. So here's all of the 6 steps, and we're going to be covering them one by one. All right, so using the 6-step strategies to question success. So let's begin with number 1. It says here, identify what the question is asking. All right, Susie, that seems pretty simple and straightforward, isn't it? What type of question is this? Is this a priority, a delegation, a SATA? A negative query? Well, if you don't know what a negative query question is basically the way a question is asking you to looking for the wrong answer. For example, maybe the question is stated, what would indicate that the client would need additional education regarding the topic? Because maybe they said a statement that would not be or doesn't fit the topic. So they need additional information. So you're looking for that answer that is incorrect related to the topic, just in case you didn't know what negative query was. Okay, so the first step is we're going to read the question twice. Why twice? Because we want to be able to just first generalize the question and get through it, the wording, and then the second time we read the question, this is where we're going to dissect it. Like with a plan, you need a plan, you need to start with the instructions. Every question has a goal. The aim could be to assess your ability to identify maybe a change in patient condition. Maybe that's what the question is designed to do, to help to see if you know how to identify change in patient condition. Or maybe the question is a delegation question, maybe designed to see whether or not you understand the process of delegation. Or can you prioritize care based on the information provided? So every goal has a question, or every question has a goal. Start with determining what the question is asking you to do, to assess or decide. So that is the first step. In other words, what is the question asking you? So usually that is at the end of the question. Not always, but for the most part, when you read the question, towards the end of the question, it's going to give you the instruction of what is it they're asking you to do in this question. So here, for example, is a question. So let's read this together. The nurse is caring for a client who is 3 days post-op from an open cholecystectomy. The nurse assessed the client has a temperature of 102.4 degrees Fahrenheit, a blood pressure of 90/40, a heart rate of 110, and abdominal pain 2 out of 10 on a scale of 0 to 10. What is the nurse's initial action? So what is this question asking you to do? Note, first of all, what type of question is this? Can you guess? Yes, exactly. One of the challenges with priority questions that you will have more than one correct answer. So the initial question is asking, what is the nurse's initial action? Which is the instruction, and it tells you that it is a priority question. We got that? Easy peasy, isn't it? So let's go to number 2. Here's step number 2. Identify the topic as it relates to the instruction. You're probably thinking, whoa, this is too simple. This is too easy, isn't it? Trust me, when it comes to identifying topics, it can be confusing. Let's take a look at the topic of this question. Can you guess what the topic is? Well, some of you have indicated it's post-op open cholecystectomy. Is that the topic, though? Let's think about how it relates to the instruction. What is the nurse's initial action? What is it that you need to take an action about? And this is where you need to ask yourself that question. What is it they're asking me to do something about? Do they want you to do something about the surgery? Or do they want you to do something about the assessment? Aha! All right, let's think about the assessment. In this particular situation, the client has a temperature, an elevated temperature. He's febrile based on the 102.4. He has a low blood pressure. He's hypotensive. And the heart rate is 110, which is tachycardic, right? And abdominal pain, 2 out of 10. Okay, not too horrible after 3 days of post-op. but it is abnormal, isn't it? So they're asking you to take an action about the assessment, right? So let's take a look at step number 3. Remember, the instruction says the nurse is taking an action about. So this is what it is. Now, step number 3, identify keywords or clues. Let me tell you a little bit about what keywords and clues are. Keywords often are detailed information that can influence the outcome. Sometimes you're going to get a question that has a lot of information, and some information is irrelevant. It's just background information. It's just giving you kind of a scenario, a backdrop of the situation. So you have to determine what is significant and what is not significant. How is this going to affect the outcome of the question? Is it pertinent enough for me to pay attention to it? So think about keywords as a hint, a clue. So let's take a look at this question and see if this question even has a keyword. Not every question will have one. So let's take a look at this one. What is the keyword in this scenario? Let's think about it. What are some of the things here in this information that can influence the outcome of the client? So, for example, let me give you a different example. Let's say a question said an 84-year-old client who blah, 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 blah. Okay, the 84-year-old is a key word because how you're going to treat an 84 is going to be different how you treat a 34. So that makes that a keyword because that's going to influence the outcome. What's going to influence the outcome in this question? The nurse is caring for a client who's 3 days post-op from an open cholecystectomy. So let's take a look. 3 days post-op. Did you guess that? How many of you got this one right? Okay. Well, why is that important? Because how a patient is going to respond 3 days after surgery would be different than if they were 1 day out of surgery or 10 days out of surgery. Let's take a look at the abdominal pain, for example. Well, if you think about a patient who's only 3 days out from an open cholecystectomy and he has abdominal pain 2 out of 10, is that an expected outcome? Would you say, I wouldn't be surprised, shocked? No, probably not. However, if he's still having abdominal pain 10 days post-op, then you would be questioning, is there something else going on other than just the response expected after surgery? Okay. So in this scenario, that's why this makes this 3 days post-op important information, because a patient who's 3 days post-op is at risk for what? Complications resulting in changes in the vital signs are connected to the surgery. Is this starting to make a little sense? So before we go to step number 4, I just want to review one more time. What are the first 3 steps that we're looking at? The first 3 steps is just analyzing the question. Something that I do not doubt you already do, that you've been doing. I just want you to be a little bit more intentional when you're reading the questions and follow the steps in this order, because this is what's going to help you be able to dissect the question and look for those key elements that's going to help you understand what the question's asking. Which now leads us to step number 4. Let's take a look at it. You ready? So step number 4. This is really an important key here. It's applying your knowledge and clinical judgment by what? What do you know about the topic? It could be the medication, procedure, disease, whatever the topic is. What do you know about it? Is the situation described an expected or an unexpected outcome? For the example of the abdominal pain, 3 days post-op, patient has a pain 2 out of 10. That's an expected outcome. That would not be unusual or unexpected, would it? Right? Use critical thinking skills to develop a hypothesis. Here's where it gets a little bit, what I call a little nitty-gritty here, because now we have to take it to that next level. All right? So what did we say was the topic? We mentioned that the topic is the assessment. The fact that the patient is febrile, hypotensive, and tachycardic, which in here, the second point, is this an expected outcome for someone who's 3 days post-op? Well, we said the abdominal pain is, but these vital signs, what are you thinking? Huh? At this stage, it's essential for you to pause and think about this for a moment and imagine yourself, what is going on with this patient? So now that you determine this is an unexpected outcome, that there's something not right with this client who is 3 days post-op with this assessment, we use our critical thinking, meaning let's put all the pieces together. We have febrile, hypotensive, and tachycardic. So it would be a mistake to try to imagine that the answer should be, this is not a knowledge exam. It is not primary school or even high school testing. Doing this could predispose you towards an option without considering that others might be better. Your job in the NCLEX is to find the best of all choices, which is different from remembering the right answer for a specific topic. So let's take a look at this a little bit more closely so you can understand what I mean by this. So again, here's the question posed again. So consider the assessment is the topic expected for a client who is 3 days post-op. Well, we determined that no, it's not. What do the vital signs indicate? Now, this is the critical thinking piece. We know our knowledge tells us that these are abnormal vital signs, but what does it indicate? Now we have to do a little analysis. We need to look and kind of dissect this a little bit further, okay? This is the critical thinking piece that I was mentioning, right? This is where we get to put all those puzzle pieces together, all right? So the answer, vital signs indicate sepsis, right? Did you think of that? Was that the first thing you thought about? Let's think about that temperature. Some of you may have been already thinking it was the patient had an infection, right? Did you think that? Yes, it would indicate the patient has an infection because their temperature is elevated. But will that account for that low blood pressure of 90/40? What would make that blood pressure low? Well, if we look at this whole thing, first applying your nursing knowledge and looking at all this, now when you put the pieces together, you're coming up with this process that the blood pressure shows significant hypovolemia, right? Now, what I've heard people tell me when we've done this webinar in the past is they will look at only the temperature and say the patient has a high fever and he has an infection. Others would focus on that blood pressure and would say, well, they're probably dehydrated or bleeding. But if you take those separately, you may come up with that conclusion. But when you put all three together, you come up with the hypothesis that this patient may be becoming septic, right? He's going into septic shock. Is that making any sense to you? I want to pause here a moment for you guys to think about this. If you didn't come up with the hypothesis sepsis, think about the reason why. Now we're going to go to step number 5. Now we finally get to look at our answer choices. It took us all this time and we're just now getting to answers. Now we get to read each answer carefully and determine if it fits the scenario. You want to eliminate the incorrect answers first. Remember, if part of the answer doesn't fit, the whole answer is incorrect. You need to justify your answer choices. In other words, why do you believe the answer is yes or no? Always validate your answers. I see this as a common mistake for a lot of nurses. When you're reading a question, you get to especially those select all the applied questions, and you're looking at the answers and it just sounds good. And you immediately want to choose the answer without thinking further and say, wait a minute, why is this an answer is a yes? Why is this a no? It's important that you pause in your answer choices and look and make sure that you have your rationale. Now, use testing strategies. If you're not familiar with our testing strategies, we have a webinar that we talk about decision tree and other testing strategies. You've been introduced to this during your phase 1 and phase 2. So those are your ABCs, Maslow, nursing process, the decision tree, and of course, therapeutic communication. These are testing strategies that's going to help you kind of look at the answer choices. And if you get stuck between two answers, you can use this to help you identify what is the correct answers. So this is a really key, important part of step number 5, is to apply the appropriate decision tree strategy. Okay? Remember your ADPI and your ABCs, what they mean. Okay? So now assessment must always come first. So now let's take a look at these answers for this question. Once again, here's the question. The nurse is caring for a client who's 3 days post-op from an open cholecystectomy. The nurse assessed that the client has a temperature of 102.4 degrees Fahrenheit, a blood pressure of 90/40, and a heart rate is 110 and abdominal pain 2 out of 10. What is the nurse's initial action? So we know what the question is asking. So now we can look at each answer and say, is it appropriate or not? Remember, this is a priority question. So A, reassess and check vital signs routinely every 4 hours. How many of you would say this is appropriate for this scenario? Well, read the entire answer. Remember what I said, the answer completely has to be correct. So would you wait 4 hours to assess this client with these abnormal findings? Probably not. It would be too long to wait for 4 hours. So remember that sometimes in the answers, there's keywords as well, which will indicate that maybe the timing or the evaluation may not be correct. So A is one that we can eliminate because it simply is not appropriate for this scenario. How about B? Administer antibiotics as prescribed. Well, as a nurse, if I have a patient post-op with, especially if they have a temperature, it would seem pretty obvious to me that I want to give the antibiotics, especially if they're ordered by the physician. This seems like an appropriate answer to this question. We'll hold on to this one. Notify the healthcare provider. When do you call the healthcare provider is the question. Well, there's a couple of reasons why you would call the healthcare provider. 1, there's a change in patient condition. 2, the patient is not responding to the plan of care. 3, what you need to care for the client is outside of your scope of practice. In other words, you don't have the appropriate orders to be able to treat the patient. So you therefore need to call the physician in order to get what you need, right? Well, we can hold on to this answer too, because there is a change in patient condition, isn't it? It is one of the criterias, and perhaps he's not responding to the antibiotics if he has a high temperature. So that's 2 out of the 3 here. And maybe we can discern that maybe the patient needs some other things that we don't have. So we're going to hold on to this answer. How about D? Medicate the patient for pain as ordered. Well, 2 out of 10, he may or may not need pain depending on what your criteria is. So that may not be necessarily a priority. So that leaves us B and C. Both very good answers. Both are appropriate for this scenario. But now we're going to go to looking at what the question is asking. What is the nurse's initial action? What would be the initial action for this patient? Give the antibiotics or call the healthcare provider? For that, we're going to go back to step number 4. Remember, you guys determined that your hypothesis is that the patient may be going into sepsis or becoming in septic shock based on these vital signs. So another way of answering this question is, what is the nurse's initial action for a client going into septic shock? Because that's really what the question is asking. So what would be your priority for someone who's septic? In other words, of all these vital signs, which one bothers you the most? Is it the temperature, the blood pressure, or the heart rate? Correct. The blood pressure, 90/40, that means he's hypovolemic. And in order to treat this patient, he needs fluids. We need to support the cardiovascular system in this case. So is the antibiotics going to fix that blood pressure? No. It's not. So in other words, we need to notify the healthcare provider because we need additional support. We need additional orders, not to mention there's a change in patient condition. So here's where we need to look at this and say, okay, what is the appropriate one? So after we've eliminated all this, the answer is notify the healthcare provider. Good job, everybody. That's exactly correct. Okay. The hypothesis the patient is showing signs of sepsis. What is the priority for this patient? What values concern you the most? We said the blood pressure, right? Hypovolemia is due to low blood pressure, requires immediate fluid resuscitation. We could have used our ABC strategies here because remember the C stands for circulation. That would have led us to this answer as well. So is that starting to make sense? So when we look at step number 6, we reread the question to determine if your choice answers the question. So is the answer choice that you selected, in this case C, answering the question, what is the nurse's initial action related to this assessment finding? And if you could say, I'm still confident that C is the answer, then you're done. Whew. That wasn't so bad, was it? Wow. Now, I know that it seems like it's a lot of steps, but I promise you that the more you practice the 6 steps, following this in this order and analyzing the question, not only are you going to get faster and better at it, but it's like you're retraining your brain to think from a critical standpoint. So this is why it's important to make it a habit. Most of you have taken some practice exams already and realized how important it is to be careful when you analyze the question and the answer options. The 6 steps are meant to make you methodical, almost robotic when you're taking the exam. Developing these habits and using the formula, no matter how easy the question seems or how hard, can help you manage the anxiety that's sure to come. Using these steps will not make you pass, but it can prevent failure, especially for those nurses who are close to that passing mark. What I mean by that is often a lot of the questions that are missed, a lot of those test errors that we see nurses make is because they get so overly confident with the easy questions or what they think is an easy question. Remember I said a little bit earlier, when you read a question and it's something that's very familiar to you, you want to jump to the fact that, oh yes, I take care of these patients all the time. I know exactly what it is, and you've already predisposed your mind as to what the answer is without following the 6 steps. That would be a mistake because sometimes you could miss a keyword in the answer or keyword in the question that you didn't think about that could change the answer. Like we just used as the example, a lot of people made the mistake of selecting the antibiotic answer because they already thought of patient has an infection, the antibiotic is correct, without looking at all of the other details and all of the key elements in the question that would lead you to a different hypothesis. Is this starting to make sense? I hope so. So don't forget that use your paper or whiteboard during your exam to write down those keywords. Take concentration, helps you to stay focused on what's important. If you're getting ready to take your NCLEX really soon, this is an important tip that I think you might want to remember. Remember to write things down as you go through the questions. It takes practice, tenacity to find keywords, and the nuances of the questions. And it can take time to become skilled at finding these. That's why you must start now. Continue build your knowledge with each question. Okay? So, are you ready to practice? Now it's your turn. Now you get to practice using the 6 steps. So I'm going to give you some questions and see how well you do. You ready? Here we go. Question number 1. The nurse is performing open endotracheal suction for a client with a tracheostomy tube. Which actions by the nurse are appropriate? Select all that applies. All right. So before I give you the answers, do want you to use the first 3 steps, actually the first 4 steps, and think about what's the instruction, okay? What is the topic? And is there any keywords? Okay. Are you ready for the answer choices? Here we go. All right. Let's take a look at the question. The nurse is performing open endotracheal suctioning for a client with a tracheostomy tube. Which action by the nurse are appropriate? Select all the apply. So our step number 1, which action by the nurse is appropriate? Very good. That's the instruction. What is appropriate? Regarding what? What's our topic? Can you identify the topic? Excellent. Endotracheal suctioning. Absolutely. This one's a little bit more trickier. Is there a key word in this question? This one is not going to be as obvious. Remember what are keywords? Details that can influence the outcome, that can change the topic. All right, you ready? The answer is open. Open endotracheal suctioning. You're going like, what? Yes, because there is a difference between an open endotracheal suctioning and inline suctioning. Often in the intensive care units, they may do inline suctionings. It's a little different than open endotracheal. So that kind of makes this a key word. So we're dealing with an open endotracheal suctioning. Now, before you look at those answer choices and selected your answers, think about a little bit of step 4. Our topic is endotracheal suction. You should take a moment to think about what you know about endotracheal suctioning. So when you kind of play it in your mind, close your eyes and imagine yourself getting ready to do the suctioning on this patient. What are some of the things that you would think about? What are some of the supplies you would need? What are some nursing considerations? What could be some of the complications that can happen when you're suctioning someone? How to avoid those kind of things? When you think about the whole scenario and you play it in your mind, now you're ready to look at your answer choices. So, administer 100% oxygen prior to suctioning the client. Now, remember I said validate your answers. Is this a true or false statement? Well, if you play the endotracheal suction in your mind, you know when you're suctioning someone during that period of time, the patient's not getting oxygen, are they? So giving them a little bit of extra oxygen and raising up their O2 sats before you suction sounds like a pretty good idea. What do you think? Sounds good to me. I'd keep that as an answer. Do you want to apply suction while withdrawing the catheter from their airway? Once again, go back to your scenario. What's the goal of suctioning? Why do we suction clients? Well, I think most of you would say, I'm trying to remove the secretions, right? We want them to get rid of all that gunk that builds up in their lungs, and we want to be able to remove some of those things, those thick secretions, so they can breathe better. And how do we going to do that? Well, we're going to have to apply the suction while removing the secretions. Kind of makes sense, doesn't it? What you don't want to do is apply suction when going down the trach. So B sounds like a true statement. C, instill sterile normal saline into the tracheostomy prior to suctioning. When would you do this? Why would you do this? Ask yourself, is this good practice to put sterile saline down the tracheostomy prior to suctioning? Some of you may say yes, some are saying no. Well, think about sterile suction. You're putting and introducing something down the trach. Remember, our key word is open endotracheal. Do you want to introduce something in there that can cause an infection? Probably not. Now, this used to be normal practice back in the day, years and years and years ago, but best practice had shown this is not good practice for nurses to do anymore. Now, some physicians and respiratory therapists may do this under certain circumstances, but as far as nursing is concerned, this is no longer part of best practice. D, limit suction to 20 seconds during each suction pass. Remember what we said in A, the longer you have the catheter, the patient's not getting any oxygen. So is 20 seconds a good time to be down and suctioning? Correct. No. We really should be limited to 10 seconds or less. And finally, E, use sterile gloves and technique throughout the procedure. Is this a sterile procedure? Is this something you would be careful with? Or do you use aseptic technique? Right. Sterile gloves is important. So the answers to this question is A, B, and E. We eliminated the other two. Okay? Pretty good. Let's look at question number 2 now. The nurse is inspecting the legs of a client with suspected lower extremity deep vein thrombosis. Which of the following clinical manifestations should the nurse expect? Select all that applies. What's your instruction? What's your topic? Keyword. Now, before showing you the answers, I want you to spend a little time thinking about the topic. What do you know about the topic? What are some of the things that you think about as a nurse? Think of pathophysiology. What happens? All right, here's your answer choices. I'll give you 30 seconds. All right, let's take a look at this one. Which the nurse is expecting the legs of a client with suspected lower extremity deep vein thrombosis. Which of the following clinical manifestations should the nurse expect? So we're looking for clinical manifestations regarding what? Deep vein thrombosis. All right. I don't see really any key words here. All right. So let's take a look at this before we go to answers. What do we know about deep vein thrombosis? First of all, the title tells you it's in the vein. Now, what does the vein do? If you have a clot in your vein, how is that going to affect your circulation? Okay. What are some of the symptoms related to that? What are some of your concerns? So let's take a look at some of these answers. Let's start with A. A says, blue cyanotic toes. Would you expect to see blue cyanotic toes with someone with a deep vein thrombosis? Is it going to affect the circulation to the surrounding tissues when you're talking about a vein versus an artery? Well, typically you will see blue cyanosis when you're dealing with arterial occlusions, not venous. So this is not something that's typically what you would see with deep vein thrombosis. Okay. How about B, calf pain? Okay, I think a majority of you wanted to select that one and say, yeah, that's usually one of the signs, classic signs that patients complain about is calf pain in that area because of the clot. C, dry, shiny, hairless skin. Okay, what would cause shiny, hairless skin and dry? Would a clot in the vein do that? Typically not. Usually we see this consistent with compartmental syndrome. Patients who have had fractures, have bleeding into the tissue, or third spacing, where the skin has been stretched really extremely to cause that. How about lower leg warmth and redness? Yeah, you got a clot in that vein? Yeah, that's another cardinal sign of deep vein thrombosis is leg warm and red. How about unilateral leg edema? Well, I would expect that unilateral meaning one leg, the leg that's affected would be swollen. So yes, that would be also correct as a correct answer. So when we look at this, we're looking at B, D, and E. How did you guys do? Did you get this one right? Did it help you that you went through the answers and thought about your hypothesis in step number 4? Exactly. All right, let's look at 3. Which response can occur if a client's prescribed a flow rate of total parental nutrition solution and is administered faster than the prescribed rate? Ooh, this is a toughie. So here we go. What is your, look at your instructions, which is your topic, and do you have any keywords in here? Okay, so here's your answer choices. Give you another 30 seconds for this one. All right, let's look at this question again. Which response can occur if a client's prescribed flow rate of total parental nutrition solution is administered faster than the prescribed rate? So the question is asking, we're giving this fluid faster than it was prescribed. What is the fluid? Is TPN. Okay, we don't have a keyword here. But let's think about TPN before we look at our answer choices. What is TPN? Total parental nutrition. Why do we give it? What is it for? Think about the solutions that is in a TPN solution bag. This is for our clients who are nutritionally deficit and are not able to eat, cannot get enough nutrition through the normal eating pattern for whatever reason. Maybe they had abdominal surgery. Maybe they have some other chronic condition that doesn't allow them to eat. And it's long term. We're not talking about a short term, but this is someone with a condition that's going to be extended. So we have to be able to provide the nutrition that the body needs, vitamins, electrolytes. It has all kinds of things in there. A lot of electrolytes as well, and things that will regulate the blood sugar. So when you think about everything that you see in the TPN, how is that going to affect the body? So if we give it too fast, What are some of the things that can happen? Well, let's think about it. There's really 4 properties or undesirable things that can happen when we increase the flow of TPN. 1, you can get osmotic diuresis. Okay. 2, we can get hypoglycemia or hyperglycemia, dumping syndrome, electrolyte imbalance. These are some of the things that you think about with that. So let's look at number 1, osmotic diuresis and hypoglycemia. So although you can get osmotic diuresis, and I'm going to talk about what that is in just a moment, does occur. The key word here is hyperglycemia is what's going to happen, not hypo. Okay. Remember, if you're giving this too fast, a lot of the TPN is going to have your sugar and insulin in it. So it's going to be a combination of that. If you're giving it too fast and you're not allowing the insulin that's in the TPN in the body to work, what you're going to have is hyperglycemia, not hypo. Okay. So even though you may have osmotic diuresis, you're not going to get hypo, you're going to get hyperglycemia. Does that make sense? If you're giving the TPN too fast. Okay. So that would eliminate A, which then consequently would automatically eliminate B, because we just explained that you're not going to get hypo, you're going to get hyper. So you're not going to get hypoglycemia. And dumping syndrome is not something that you see with TPN, do we? Now, we do see this with patients getting NG2 feedings, right? When we give, food that's going into the jejunum too fast, like when we're giving nasogastric enteral feeding, not parental feeding, okay? So this one is not applicable to this answer choice. Does that kind of make sense? All right. So remember I said off the bat, if we thought about in step number 4, we said electrolyte imbalances and osmotic diuresis, we have a lot of electrolytes that we add to our TPN. So if we're giving it too quickly, the hypertonic TPN solution pulls intracellular fluid into the vascular compartment. It increases the blood volume, increases circulation to the kidneys, raising urinary output, and that is what osmotic diuresis means. Basically, you increase your urine output because of this osmotic fluid, of pulling fluid into the intravascular system and causing this to pull out more fluid. So you get maybe potassium, sodium are the more common electrolyte imbalances you would see, but you definitely are going to see electrolyte imbalance and osmotic diuresis when you're giving TPN too fast. And like I said earlier, dumping syndrome is more related to more the enteral feedings than it is with TPN. So the answer correctly here is C. I know this one was a toughie. This is more, you just have to put that critical thinking head. You got to think about what the terms mean. Even if you're not savvy about TPN, think about the words osmotic diuresis. What does that mean? Sometimes just eliminating some of the common answers. This one, like A and B, was easy to eliminate because both of them hypoglycemia and they can both be correct. So that only left you C and D if you only just based it on the words. So if you eliminated A and B because you know it was not hypoglycemic, it leaves you C and D. And you know dumping syndrome doesn't happen with TPN. It happens when enteral feedings. Just through the process of elimination, you could have gotten this answer correctly, even if you couldn't kind of rationalize it yourself. Are we learning something? I hope so. I know this is fun for me. Okay, so let's look at question 4. We got 2 more questions. The nurse cares for the client with a pulmonary embolism. Which of the following clinical manifestations would the nurse anticipate? All right. So we have our instruction. We always start there. We go to our topic. We see if there's any keywords. And then we think about that topic. Think about this topic. What do you know about it? Once again, think about all the things you know about it. What would you expect to see? What will be some symptoms? What would some output? What would be some clinical manifestation? What would be some treatments? Think about all of that. Ready? All right, here are your answers. Another 30 seconds. Okay, so let's think about this one. We have, what would the nurse anticipate? What are some clinical manifestation the nurse would anticipate is our instruction regarding what? Regarding someone with pulmonary embolism. So let's think about pulmonary embolism. What is it, first of all? I think most of you know pulmonary embolism is a blockage in one of the pulmonary arteries in your lungs caused by a clot that travel to the lungs from a deep, maybe a deep vein, like our previous question with the patient with the DVT. It could have come from anywhere, right? So now symptoms may vary depending on the size of the clot and how much the lung is involved. But typically what you would see is some of the more common things in general. So number one, okay, would we see, oops, I already gave you the answer. Oops, or part of it. Let me go back. Bradycardia. Would you see bradycardia? Now, remember, you can't breathe. You have a problem. You got a clot in your lungs. And what is one of the things that the body will do? Remember, the compensatory mechanisms of your body is to what? To help get rid of this, to help bring back homeostasis to the body. So what you're going to do, everything increases, right? Everything is elevated when the body is trying to compensate. So you would not see bradycardia. You would actually see tachycardia, right? Could you get chest pain with that? Possibly, yes, because, you're thinking a patient with, having this lung and pressure not being able to, they're going to feel like they're having chest pain. Would you be shortness of breath, dyspnea? Without a doubt, yeah. And would you have a low PO2? Because now you're blocking, you don't have that exchange of gases and airway to the alveoli, so you can have dyspnea, and we're going to have hypoxemia, right? Okay. Tachypnea. Well, typically when you see tachypnea, what do you see there? Patients with increased respiratory rate, yes. But tracheal deviation, typically you don't see tracheal deviation with a pulmonary embolism. This is something that you would see most when there's intrathoracic pressure, such as like you have a your chest collapse. So you might see that with that, but this is not something you would see with pulmonary embolism. Typically you would see tracheal deviation with, and I can't think of the term that I'm thinking about, as a result of intrathoracic pressure, such as a pneumothorax. I'm sorry, I couldn't think of the word pneumothorax all of a sudden. But yes, so these are the answer. You would not see bradycardia, you would not see tracheal deviation, but definitely the rest of these kind of make sense, does it? Your body's compensating, you don't have enough oxygen to the tissues, so you're going to see some of these manifestations. All right, let's do one more. A client is admitted to the oncology unit for chemotherapy. To prevent an acid-based problem, which findings would the nurse instruct the unlicensed assisted personnel to report? Okay, remember, what is the instruction? What's your topic? Is there any key words? What do you know about this topic? Think about it. All right, here are your answers. All right, here we go. So in this particular question, it says, what would the nurse tell the unlicensed personnel to report? Regarding what? Regarding a patient to prevent acid-base problems, who, keyword here is receiving chemotherapy. Okay, so we do have a keyword in this question. So your topic is you want to prevent acid-base problems. All right, so you have a patient with chemotherapy. So let's take a look at some of these answer choices. Let's start from D and up. Just change it up a little. Let's think about this one. Client, I'm sorry, there's an error here. Client hair loss during the morning bath. Client's hair loss during the morning bath. Is that something that the UAP would report to the nurse immediately? Is that something that's an expected outcome or an unexpected outcome? Patients getting chemotherapy. So this is something that would be expected. It has really nothing to do with acid-base problems, does it? C says failure to eat all foods on the breakfast tray. Again, it could be an issue for someone on chemotherapy that you want to address, but what does this have to do with acid-base balance? How about B, reports of pain associated with exertion? Patients with cancer are going to have pain, and you do need to address it, but once again, does this have to do anything to prevent acid-base problems? The only one that's even logical is A, repeat episodes of nausea and vomiting. As patients get nausea and vomiting can result in what? Acid deficit that can lead to metabolic alkalosis, right? The others findings are important, but they don't address or are related to acid-base balance. So sometimes a question like this may seem pretty difficult when you first read it and you're thinking, uh-oh, I don't remember a whole lot about acid base and alkalosis versus acidosis. And already your stress level is going up and you're thinking, I don't know if I can answer this question. But really, if you think about it, this was an easy one to answer because you can go through that process of elimination. And by just simply eliminating the other three because they have nothing to do with acid base, you're only left with one. So sometimes you stress yourself out thinking about the question being difficult when a lot of times it's not going to be challenging at all. All right? Okay. So like I said, the answer correctly is A. Okay. And finally, we're done with our questions. So another thing for all RNs to be aware of is the fact that your questions will be mostly scenario based. This is to see whether you have the critical thinking skills a nurse should possess and use when they're caring for patients in the USA. In some textbooks or in your own country exams, you may have seen that knowledge recall was all you needed to answer the question correctly. But on NCLEX and most practice exams, the questions are focusing on the higher level cognitive skills of application and analysis. Therefore, just reading a book or some notes is not enough for you to be able to pass the test. You must think things through as a clinician, not an expert in memorization. Okay. So with that, this is going to conclude our webinar. So because this is a recorded webinar and you did not get an opportunity to ask questions, it wasn't a live, what I recommend is that if you had any questions about any of the topics or anything that we talked about, please email your instructor and make sure that you are scheduling a call with your instructor, okay? Because you want to be able to answer those questions. So if you can email email your instructor and request a call, or ask questions through the email. That would be fine as well, so that you can get that feedback. But if you miss any part of this webinar, you could always repeat it as many times as you need to. Look at the questions and answers and make sure that you review them and remediate them. Meaning, if we come across a topic that you just didn't understand, or you know that you have a deficit in, you need to research that information on your own. Don't forget our favorite website, registerednursing.org/NCLEX, is an awesome website to look at content material. If you need additional learning support, such as videos from the registerednursern.com, those are also excellent videos that can support you in different topics. There's one on acid-base balance as well. So you can look at any one of those videos to help you supplement your learning and all of those things that you need to build up your knowledge. I hope this was helpful to you. I hope this is going to be significant in helping you to do better on your platinum exams and, of course, eventually on your NCLEX. Until the next time, I want to say thank you for joining me today. And in the meantime, be blessed, be safe, and don't forget, wash your hands. All right. Bye, everybody.